Okay, today is July the 6th, 2020. The city Shelby Department.
Beth, you're kind of breaking up here.
Well, we got our mask on because we're sitting side by side.
Yeah, but I think it's just a signal for some reason. Sounds still.
Well, because we have such good internet.
Hang on.
Hello.
Must be crisscrossing. Is that Dr. Chawla?
Hi. Good afternoon. How are you?
Good. Good to have you on board. We're just opening up our Shelby City Health Department Advisory Board meeting on July 6, 2020 at about 2:03 p.m. Hey, Doc, do you have your agenda before you by any chance?
Yes, I do. I do.
Okay.
So yeah, thanks for, by the way, everybody coming here. Monica, hi. Good afternoon.
Hi.
Hi, Steve. How are you?
Good.
Good. Is Beth, you okay?
This is Lauren. Yeah, we're trying to reduce some noise, background noise in this room, but she and I are both here.
Oh, okay. Good.
Very good.
Take this back, or you want me to hold on to it and then you bring
Hi,
it?
Tiffany.
Oh, Tiffany's on.
Okay. Salad for us.
So, I know we had problems getting the meeting scheduled last month. So thank you for your patience and your commitment today and having come to the meeting today. I know that with the COVID-19, we have changed our business and how we do appointments and or like affecting my office, for example.
Oh,
So, Tiffany,
Yes.
hi. Do you have the recent stats to go over and share with the advisory board?
yeah.
Okay, so Shelby City to date has 26 total cases for the city. 17 have recovered. So there's 9 active cases currently and 2 suspected cases. So just in the past week, we have obtained 9 cases in the city. As far as the contact tracing goes, when I receive a positive case, either from a lab calling me or checking the Ohio Disease Reporting System, once I confirm a case, then I give the individual a call and I do an interview on them and collect all of their information, such as when they became symptomatic, when they were tested, when the positive test came back. Then I have to find out if they have any pre-existing conditions, and then I have to ask them for all of their contacts that they've had within the last 48 hours prior to the first onset of their symptoms. So once I get their contacts, then I call the contacts. And if they're in the Shelby limits, city limits, then I put their name, their date of birth, their address, and then the COVID-19 case that each contact is linked to. And that goes into a database and is monitored then every day. It's the Ohio Contact Tracing System that information is put into. And then they are contacted every day, and a AM and PM temperature is recorded, as well as if they're exhibiting any symptoms. And this is done daily for 14 days. And if they exhibit any symptoms during that time, they have the preference of getting tested or not. If they do not get tested, then they remain under quarantine until their symptoms have resolved for 3 days in a row. If they do test positive, then they are quarantined until they go 3 days in a row and have no fever, no symptoms, and no anti-fever reducing medication. If there's a contact in another jurisdiction, then I call that health department and relay the information so that they can carry out the contact tracing. I also have to produce letters for employees that either need to be off work or return to work. And this is a 24/7 process every day.
So it's kind of challenging, isn't it, Tiffany, to have a sudden uptick in the number of cases? Last week has been more difficult, correct?
Yes.
And do you think is expected from how the state is opening up as per the guidelines?
I do, because out of these 9 cases, there was only 1 case that was linked to Handline, which is one of our outbreaks. There were 4 other ones who do not work outside of the home. They're homemakers. The couple I had today, they traveled to Florida and then became symptomatic and flew home. And then they traveled up and was at the lake all weekend, and there was, great exposure there. They exposed, so.
So they flew on a plane when they were symptomatic, correct?
Yes,
Oh, wow.
yes, so
So certainly, it shows the awareness or how people should behave differently when they know that they could be exposed and not travel by a commercial airline. So I'm sorry, but they probably have infected other people in the plane as well, or in the
I'm
lake
sure.
yesterday.
Yes, I did get a hold of the contacts from the weekend getaway up at the lake. So, but yes,
We have to inform the commercial airliner.
that is on the agenda.
Right, we should technically inform
Yes,
the airline of the exposure.
absolutely, absolutely.
Wear
So,
a mask while they're flying?
yes,
Okay,
I
they
think that's
were
mandatory.
in flight, but not this weekend up at the lake. They weren't.
okay. All right, so just to let everybody know that as at least what Tiffany will know for sure, everybody, but if they get infected or they have been exposed to, we have few staff members in the hospital who were positive and they're quarantined and they're doing well. Shelby Hospital is not admitting anybody with COVID-19 between Ohio Health, Mansfield, and Shelby. Mansfield is designated as a COVID-19 hospital. So all the patients will be transferred to Mansfield if they were positive for COVID-19 in Shelby. And everybody who comes to Shelby Hospital emergency room is tested for the virus before they get anywhere else, like x-rays, labs. So moment they walk in the room, they're tested for the virus. And we have I will go over the testing, but we are, just like Tiffany has mentioned, she is doing the efforts to keep the contact tracing. And contact tracing is very important. And most countries around the world who have done a good job and two examples are Taiwan and New Zealand. They did only by aggressive contact tracing. That's how they could control the disease. And of course, awareness. So we are very good in that. And New York State has also done the same thing. The reason they have done the flatten the curve is by aggressive contact tracing of all the people who were positive or who were exposed. And I think we are doing the same job here. So hopefully by tracing and identifying all the people exposed to, we will be able to help people be aware of that they could expose and they should be tested if they have symptomatic.
Mhm. And Beth and I were speaking this morning, and she is still getting complaints about the vault because they are packed in there, and that's what's happening. That's when I emailed you this weekend. I believe that these cases are not linked, except for the couple today, but the other ones are not linked and aren't hanging around with each other, don't even know each other, but being exposed and they're contracting it. And I believe it's just places are opening up and people are not distancing, they're not wearing masks, and they're contracting it. And it's just, we're going to have another spike, I believe, in cases.
We'll talk about, and for advisory board, Steve and Monica, Tiffany, just like she mentioned, we are really promoting use of mask use outside public places for sure. Not to travel unless they have to, especially elderly and sick people. If they go, please put a mask on. We always promote social distancing, but once again, everybody is different in terms of thinking. And one common mistake is that it can not happen to me or it will not happen to me. And it's something which people have false assurance that they will be able to beat the virus, or I don't have any problem, why should I be wearing a mask? So unfortunately, the number of cases have gone up last week are a result of people taking liberties or dropping the guard off. And hopefully the message, and we are using our Facebook or our Instagram or our social media network to promote the message that we are seeing an uptick in the cases, and the city of Shelby residents have to be more vigilant, and they should follow what the ODS guidelines are, or the CDC guidelines, which is traveling and not go to public places or packed places, not more than 10 people in the room, and use face mask whenever you have to go to a closed space or a public place where you cannot maintain social distancing.
Mm-hmm.
So, but it's a little bit disheartening to see we had a flat curve or flat line for a long time, and suddenly this week we have quite a few cases. Alrighty. In terms of reporting, Beth, you want to add on something about the complaint process now?
I was gonna do that when we get down to my department, but I.
Okay. I thought okay, thank you. Tiffany, something else you want to add on?
Let's see. Do you want to talk about vaccine clinics now?
Yes, no, it's part of, we'll talk about it in your meeting, but any more cases, anything you want to bring to, like, it's not, the cases are not affecting the nursing homes?
Yeah,
or daycare?
So far, there aren't any outbreaks at either of our nursing facilities. Nothing at daycares. I have 2 outbreaks, and those are at Handline and Onion Boy, which are located near each other. And I spoke with Huron County Health Department, who is handling nearly all of those cases and found out that they were riding together. They're carpooling, and so that we're having a great exposure that way. So I spoke with HR at both places, trying to educate on that, educate on the mask or face covering wearing, cleaning the high touch surface areas there at the businesses, providing the hand sanitizer, lightening up on the call off procedures like point system and stuff. That way they're not coming in sick, exposing, and then leaving. Like, make it so that if they're sick, they do not have to come in, they do not have to report. I actually have a conference call tomorrow at 2:30 with Handline and CDC NIOSH, the NIOSH team, so we can all work together on this to squash, try to squash the exposure and the outbreak there at Handline.
Okay, good.
Yeah, that's.
So, so again, Monica and Steve, we are at least promoting the education, trying to reach out to like nursing homes, for example, sending letters or emails to make sure that all the employees wear face masks, especially in a crowded place or a place like nursing home, where there could be one person can expose a lot of people at the same time. And I have phone meetings with them, with the medical directors of the nursing home in this area, with Ohio Health as well, and their team of infectious diseases to promote the lifestyle changes as the disease is still spreading in the community. I will now move on to testing and antibodies testing, what you call testing protocols. And we have last at least 4 months heard a lot about testing being done and the challenges in testing, the kind of testing, what we're doing about it, and which hospital is doing what, and where we go for testing, and how do we get tested for somebody. So it's true that for a couple of months we had big challenge in getting patient tested for COVID-19. It has got better. We have a lot more players in the field now who are offering testing. So the first and the most important test we offer to everybody, which is, I would say, the gold standard, is doing a viral DNA particle testing, which is taking a swab from the nose, which is what Ohio Health is doing. Ohio Health and Avita are doing a testing differently. But Ohio Health, what is doing in Shelby and Mansfield, they're using a 5-minute kit. It's called Abbott's 5 minutes COVID test-19 kit. It's actually very easy and it doesn't take much time, easy to use. The only discomfort is a nose swab. And this is what we in the ER. It really is very easy. 3 pieces of the equipment. Comes a swab. You take a swab and put into a kind of a plastic bin, and it has a liquid. It dissolves the nucleic acid particles of the virus. And in 5 seconds, the machine will change the color and will tell you positive or negative. It's really easy. And I think Ohio Health has a limit of how much testing they can do. But they are not offering testing to common public in Shelby Hospital or Mansfield. So they are doing only for patient getting colonoscopies, major surgeries, procedures, or ER visits. But if the patient has to be tested, if they are exposed to, like Tiffany had mentioned, contact tracing, if somebody in your family is exposed to and you aren't around them and you want to know if you are positive or negative, you have to have Ohio Health be tested for you. But it would be on the, in Mansfield area, is a outpatient walk-in or drive-in center, also on the Nussbaum Avenue, it's in Mansfield. What we had for this procedure, Ohio Health requires a doctor's prescription though. You have to have an order and doctor has to call a hotline, and the hotline nurse will get the information and the phone number. They will tell the patient what time to come and get tested. But if you don't have symptoms just be exposed to, you would not be able to get a testing done. So Ohio Health is limiting testing to patients who have symptoms, who are exposed, and who are healthcare workers, or people like traveling from Florida who were possibly exposed there and they have no symptoms or they have symptoms. So we are doing that actual viral testing in Ohio Health, Shelby and Mansfield, and their drive-through center. Now, the urgent care next to Walmart, the rapid response center, they're doing a blood test, which is a finger stick, like you prick the finger and you do a test in their facility. But that's actually antibody testing. Avita, Ontario, and Galleon also doing a blood sample for testing for the antibodies. The problem with the antibodies is that it cannot tell how long you have the infection, how many, or if you are actively sick or not, or whether this antibodies will help you prevent the infection in your life again or not. We know the antibodies testing has fallacy. 50% of people may not show antibodies when they are acutely sick because the antibodies takes 2 or 3 weeks to increase in the bloodstream. So for a couple of weeks, you might be having active infection, but the antibody test will come back negative. So if you are actively sick with cough, fever, body ache, chills, the test is not the antibodies testing. It is a nasal swab. Then you have to be tested for it. Now, CVS, as of last month, started on their West 4th Street in their pharmacy, a outpatient testing. That's the only pharmacy who's doing a outpatient testing all over the country. They are actually very good. In fact, they're much better because they don't need doctor's prescription. You don't have to have insurance to get tested. If you have insurance, they will take the information from you. But if you don't have insurance, you can, and they will not charge you. So you simply have to call them number, go online, you type your name and tell why you need it, what happened to you. Somebody will cross-reference you, and they will tell you what time to go there. So you simply drive through that CVS West 4th Street. There'll be a person who take a sample, but the result will take 2 or 3 days to come back. Unlike Ohio Health, which gives you a result in 5 minutes flat, the CVS facility or CVS pharmacy on West 4th Street, the result will take 2 or 3 days to come back. So that's the only disadvantage they have. But CVS is a lot more easier. You can choose the time you want to go. You don't have to pay for it. And it's much more, there are a lot more hours. And there's no doctor's prescription needed. So in terms of the actual testing, nasal swab or nasopharyngeal swab is the best test. It tells you if you have active infection or not. The antibodies tested, if it's positive, it means you were sick in your life sometime. You have infection more than 2 weeks back. It doesn't tell you what will happen to you though. Antibodies are not shown to provide protection against the further infection. And also, once you are positive, oftentimes nasal swab is positive week or two later again. It doesn't mean you have a reinfection or you have another infection. It only means that the viral particle, your body still has it. Doesn't mean you are sick or infected. It means you may have a dead virus. It may show up positive, but doesn't mean you have active infection. So oftentimes people are thinking, if I do a second nose swab, and if it's negative, I can go back to work, or I don't need a quarantine. CDC does not recommend second testing to go back to work. It does not, and neither Ohio Health is. So if you want to do a second testing for your nasal swab, if you are positive before, to go back to work or be off the quarantine, that's not how it's going to work, and it's not needed. So if you don't have symptoms and you're positive one time, wait for 2 weeks, like Tiffany is suggesting for everybody. And if you have no symptom of 2 weeks, you're good to go back to work. But the antibody testing would not let you off the quarantine sooner. Antibodies would not help you know if you're going to get sick again or not. It would not tell you how long you had the infection. So there's a little ups and downs. But if somebody is actively sick, the best thing is to do a nasopharyngeal swab, either CVS or through Ohio Health. If you feel that you had infection 3 weeks back and you want to see whether you were infected or not, antibody testing would be a good option, and that will be through Avita Health. But in terms of testing, we are expanding. As you can see that more the testing, we are seeing more patient. To be honest with you, if we had testing before 3-4 weeks back, like what Tiffany is doing, we could have done a little bit different job where we could have reached out to a lot more people who were sicker and could not get the antibody, could not get the testing done because we didn't have the swabs that time. But one of the reasons why we have so many cases in the country now is because people are taking advantage of the lockdown being lifted or having those phases of opening up the economy. So I'm for opening the economy as a physician. I think our country has to move on. I'm for having people, do what they have to do in the life, but they should not drop the guard of social distancing, neither the mask. Unfortunately, people are not either following distancing protocols or not using masks. And that's the reason why we are seeing so many cases nowadays. And Tiffany mentioned about the Walt, the restaurant in town, where they have a lot more cases, or they were concerned about whether the cases would come from Walt in next few days. I think we need to reach out to the owner and make sure that they don't become a hotspot for the city of Shelby.
How would we know they're coming from the vault?
There won't be no way to know that.
I mean, again, I understand what you're saying too, Doc, but I mean, there are several places in Richland County where people are going but they're not there for long periods of time, which I think that probably plays into it as well, correct? I mean, if you're going back and forth with people for 3 or 4, 10 seconds, rather than sitting at a meal for a half hour or 45 minutes, I think chances are greater to contract the virus, correct?
As a city health department, we are responsible for what's in our city jurisdiction. Certainly, I cannot control what Mansfield does. Their health department should be responsible for maintaining their restaurants, their social distancing. If we have a place where people are not following social distancing, they're close to each other, not feeding the mask, certainly, and we having 7 more cases, we are likely to be the area of concern, because Crestwood Care Center and the nursing home in Heritage, which is the on the Mickey Road, that's only 2 places I know where a lot of people are in one building at one time. And if they are using shields and masks and hand sanitizers and temperature checks, and if Shelby Hospital, anybody goes for blood draw, they have to put the mask on and get a temperature checked. It means we are promoting what we call a adequate checks and balances on protocols in place from ODS, that we will not let anybody come in the building if they have symptoms of infection. But many places which will not enforce those, I'm not picking up Walt. Walt is one example. But if people are complaining, calling our health department, certainly we don't go and visit them. But people are calling our department and they're complaining that people are not following social distancing. So certainly there are a lot more concern from the people who are visiting those places. So we should at least try to encourage Walt or restaurant like this to at least enforce some kind of restriction. I think the onus is not on us as much as on the facility or places where people go to. I don't think we have a legal tooth to it. Even our governor says that it's highly recommended to wear the mask, but there's no law that you have to wear a mask. Like state of Texas, there were so many cases, so the state governor has issued a restriction that everybody in state of Texas has to wear a mask outside. So your point is well taken that, yes, we will not know if people are coming to Walt getting in, but we're getting complaints from Walt. So we have to not ignore that.
Mm-hmm. Yeah. So,
but if that could be true for any place, I'm not certainly suggesting in this meeting and suggesting that Monica or Steve that we have one business more than the other, but any business who is having people in the building in a closed space should try to enforce some kind of restriction.
mm-hmm.
And Mayor, I don't think we have any legal tooth to that. We can
Sure.
force them. But there's no way to tell whether people, Tiffany mentioned that all the cases we have so far are not linked with Walt. But we have a lot more phone calls about Walt.
Right. It's, of course, it's pretty well out in the open and people are watching what's happening and so forth. And I don't know if the complaints are so much outside or inside or both. I don't know, but in any event, it doesn't matter. It just,
And just like Mayor, since we had the council have the concern about the complaints not being tracked
anonymous or
appropriately,
whatever, yeah.
anonymous complaint. So we had to be a lot more vigilant about council and feeling that we need to do what we have to do as a health department.
Right.
But once again, Mayor, we cannot admit we don't admit anybody in Shelby with COVID-19. My concern is that we only have limited EMT staff and the cops and the first responders. So if we have a lot of people who are sicker and they are short of breath and they have to call 911, we are possibly exposing our EMT staff or first responders. And since if they get infected somehow or get contact with somebody, they will be off work for 2 weeks. It means we may not get our first responder to replace somebody who's got sicker. So I'm concerned about how it will affect our health system if we see a lot more people are sicker and using health services for us.
Right.
So we should try to not make this number. I'm worried about, just like Mayor, you are. I saw your emails. I know you're concerned about the cases and you have been, worried about. So we feel that we as a health department try to keep our numbers patient down as much as possible with all the efforts we can make.
Yes.
So that's for me about the testing.
That was very interesting. Thank you, Doc.
Sure. And Mayor, would you, legislation, I think that piece is what, if you could share
Right,
about
yeah.
the council.
I'll touch on that grant funding as well. We received, actually have available to us through Richmond Public Health, approximately $12,000 worth of grant money for COVID-19 related expenses. But the only thing we've spent at this point is we purchased a 5-gallon container of chlorine oxide that can be diluted for spraying services. It's supposed to be very effective, and I believe it's CDC approved. So we haven't really spent much of that grant money at all, and kind of wondering how we could, or in what areas, but that is available. Sometimes departments are using it for contact tracing. Right now, Tiffany's been doing all the contact tracing. And in larger departments, of course, with larger populations, that's a huge issue. And some folks are using that, as I understand, for payment of other personnel to come in and help with contact tracing. But that money is available. And I think we'll be looking at the department, if there are ways we can invest in our public health, that would be a great resource to use without tapping into our levy monies. So that's just a little bit about that grant. Actually, we're two different grants that total up to about $12,000. And then as far as the legislation, Dr. Chow did mention for this third reading, amended ordinance number 15, 2020, amending the section of ordinances that speaks of investigation of complaints, correction, and reports to council. And the amendment is in the paragraph for the health commissioner and his or her designee in order to investigate a complaint of nuisance, report for public record, the name of the complaint and the outcome of the investigation. And then it talks about reporting to council from time to time as council may require. And we kind of went over this, and I've spoken to the sponsor personally. We've talked about the name of the complainant, and Beth did a lot of homework on this. We believe that the anonymous complaint is just as valid as one who places their name beside it. Needs investigated just the same. So on this piece of legislation, it said they shall record the name of the complainant. And we do that. But my question was, well, if they don't give their name, do we just throw the complaint away, or do we follow up? And that's what we're going to follow up. So there may be an amendment coming this evening following that little phrase to put like either if provided, if the complainant's name is provided, if it's provided, or if it is known, then we go ahead and record that. But on our COVID-19 reporting sheets, we have placed the language in such a way that it just says, please, here's the thing we made up for those who want to see it there. And this was kind of taken off of Richmond Public Health. It says, please provide your name and contact information. This information is not required, but will help us follow up if needed. So we give opportunity. But still, if they do not give the name at the bottom, if we do not record the name, we're still well. So I don't think the legislation is going to change much about how we do things. We'll see. We'll see what the conversation is like this evening, but I believe it will be amended. Allow that if the complainant name is known, or if the complainant's name is provided, then we would record that as well. So that's the piece of legislation that's on the agenda tonight. That paragraph has been in this. The paragraph has been in our ordinance book for some time, but that's why I say it's amending it.
Monica, you have any questions or concerns so far in the testing
No.
or updates or grant funding? Mrs. Steve, any concerns?
I have just one thing that, would the person who takes the complaint on the legislation that comes up tonight, could the person who takes the complaint could just remind the person calling in that they could provide their name or not, and let them know that if they do provide their name, that there may be someone who might want to know that, and let them know that that's going to be a public record.
Right. Beth, that's probably more your department.
We already do that now. I mean, we already have not legislation, but we have a health department policy that we already do that. And, we give them the option. The problem with the legislation, the way they want it, is he wants it recorded somewhere. Well, if we record it, it's going to have to be in health space. And if it's in health space, say one of the food places, we've had 6-7 complaints there about social distancing. What's going to happen is that's going to show up on the state website, and it will show that many complaints under that facility. And then you worry about, well, are those people going to read every one of those complaints, or just say, oh, it had 6 complaints and we're not eating there, or, that type of stuff. So we already have a policy in place that we've always followed. We do, it acted like in the legislation, like we weren't documenting it anywhere, which is incorrect, because we always have. We did not put the COVID-19 complaints in there because they were different than what we've ever had. But so I started putting them in there, and it is what it is. So that way I'm not going to get accused of not doing my job.
Mr. Steve, just want to add my 2 cents here. Like Mayor mentioned that anonymous complaints are considered valid complaints. Certainly, I don't think, and Beth I have not seen in the last 10 years of my association with the health department that we will not take anonymous complaint just because they're anonymous. We'll follow them and treat the complaints as valid complaints. Certainly, having a name disclosed, some people have their own thoughts about how it will be reflected on. Somebody knows who complained, and you know what I mean. A small community, people know each other well. So, like Mayor mentioned, that we have to take all complaints valid, whether it's anonymous or not. We give the option to the person that they can have the name. So what Beth has mentioned, health space is a depository or a database where all the details of a complaint goes. It becomes a public record. So it means anybody can request who complained, how many complaints came in, and who are the name of the people who complained. But if somebody doesn't want to give the names, we still do have to record those complaints. We cannot just put them in trash can, for example. So like Mayor mentioned, all complaints are valid complaints.
And we do log them in Health Space, and there's a box that if they don't want their name, it says, ask the anonymous. You put the box in there and, or, the check mark. So you do an anonymous complaint anyway.
And working with Beth and Mayor and previous environmental person, we all take complaints seriously, and all complaints are followed up in many ways. So even though we are small health departments, we take complaints seriously and follow them as far as we can go.
But like you say, with a small town, anonymous complaint, you would not want to discourage, you don't want to discourage people from
Not complaining.
giving a valid complaint for something that's a true problem. And we don't want to discourage people from doing that because they think that their neighbor is going to, give them a hassle because they were turned in for one reason or another.
Right.
Yeah, just Mayor said the same thing. My concern was same thing, that the amendment, the way it's written so far, will discourage people from anonymous complaints. So we're trying to work with the sponsor of this particular piece of legislation, where we should be able to take all the complaints, whether it's anonymous or not.
Right.
Thank you.
Thanks. Thank you. Thanks, Beth.
Thank you.
Moving on, environmental health. We are doing mosquito trapping this year. Right now, counting them, and that determines when we do the mosquito spraying. We'll be spraying Wednesday night. We haven't had great numbers, but we want to not get out of control. So we have an intern that does those for the summer for us. I requested shipping labels, state of Ohio, but they're storing them, so maybe at a later date they'll check. Mobile home parks, we do mobile home park inspections for the Ohio Department of Commerce through the state of Ohio. They ask us every year to contract with them, so we just signed a contract for 2021 to do those inspections for them for next year. We already did ours we have to do them between March and the end of June, which we have 4 manufactured housing parks in Shelby City, and we did all the inspections and sent all the reports in as required. COVID complaints, since they put the legislation out, it's slowed down immensely. I've only received 3 for the whole month of June since they. More of it, I've just had people, not necessarily complaint at the vault, as saying they were there and they were not social distancing. Letting us know that they're not doing that. Rabies, we've had a run on dog and cat bites in the last week. I've had those. And I can pop up. I just have to go knock on the door, try to 10 days to stuff after I look for animals and get the vaccination requirements that we need. So inspections for the restaurants, I've been staying on track with them. They're all on track. Health out a letter that since COVID, a lot of departments aren't getting their inspections done because a lot of restaurants aren't opening. Like we have Ted and House is not open yet. So the inspections are not open. Survey, as long as I can make a note why they're not and that type of stuff, and can show why we can do it, not just because I didn't be okay. But all of our other inspections are on track, and we're on those. That's pretty much all I have for environmental health.
Alrighty, thanks Beth for the update. Tiffany, you want to add on about the vaccination clinics and see how it's affecting our community, especially the vaccines are on a back burners in the COVID virus.
All right. So we had 3 vaccine clinics scheduled for one for July, August, September. We had to postpone July's vaccination clinic because we work with Richland Public Health. They come over and assist in those, and they have postponed until they feel they can safely resume the clinics. They're currently developing plans on how to do that. I did reach out to Shelby Health and Wellness and Demir's office and let them know that children ages 7 and older, adolescents and adults, they all have the option of obtaining vaccinations at retail pharmacies. So there are people utilizing that when we do reopen, which hopefully will be for our August 13th clinic. We're hoping to take care of the newborns, babies, and up to 6 years, like our kindergartners and things like that. So hopefully that we'll be able to do August and September's. I'm working with Amy, the director of nursing over there at Richland Public Health, in regards to that. And then as far as getting out into the community, I'm going to safely try to get back to the senior center and check blood pressures for the people that come in, and they're coming in to do the exercise classes. So I'm working with Pam there at the senior center, setting up, and every first Wednesday of every month, starting in August, to assist the elderly population there with blood pressure checks.
Tiffany, hi, Tiffany, do you see
Yeah.
this changing much in next few months to come?
We're just gonna have to watch the numbers and see how it goes.
And once again, Mr. Steve and Ms. Monica, we are still struggling with getting vaccination, just like Tiffany mentioned. But that's true with all over the place in the country. We are way behind vaccination in almost every state for many reasons. The health departments don't have their protecting devices for, well, they're getting more PPEs now, but before they could not have the staff maintain the isolation, social distancing, and mask use for people to get vaccinated. So most children who are born are getting vaccination from doctors' offices, but health departments and clinics have getting difficult time getting vaccination. So we are behind on that. But the Third Street Clinic does see some children, and Ohio Health has their physicians see the children who are giving vaccination there. So if the children need vaccination, they can get from Ohio Health facility. But they have to be patient of that facility. In city of Shelby, there are not many people, not many physicians see kids less than 7 years old. So it's affecting their practice a lot more than, for example, in my case, when I see own children. So it has been a challenge, like just Tiffany mentioned. I do not see if it's going to change much in next few months, but I hope the Richland Public Health would have the staffing and the material to give vaccination children and keep social distancing and protect the mom or the babies for vaccination. We'll give you update as we hear, but so far we have not got any confirmation from Amy, who is a director of nursing of Richland Public Health, of having a clinic in Shelby soon. Right, Tiffany?
Yes, that is correct.
Okay, well, thanks. Anything else update on community health and nursing?
No, not at this time.
Mayor, I need your time again for update on the Shelby Health Coalition, please.
Right. If you see on the agenda, this is a kind of a working title that Lauren put together for us, the Healthy Shelby Coalition. When I first came to office, Carol Price came into my office and was explaining about this creating healthy communities. I didn't really fully understand it until she explained it. From Richmond Public Health, I believe they were getting grant monies to help communities in Richmond County to do exactly that, to create healthier communities. A lot of that through health education, try to change vendings from candy bars and pop to vegetables or fruits and healthy drinks and so forth, water, pushing the drinking of water. So we began to have meetings in Shelby with Carol Price and others, and that kind of grew. We invited a few more folks in. We had participation. When this thing kind of actually, the creating healthy communities went away, I believe. I think the funding dried up, if I recall correctly. And but towards the end, we had the YMCA at the table for the middle school, a library. I think maybe had some representation for the hospital, but it was a good group. They helped in the parks. His brother Jerry Marshall started coming with handicapped swings and so forth in the parks, trying to get non-smoking in the parks. The library, I believe the blood pressure cuffs came from this coalition, and the YMCA was at the table in a very real way. So what we'd like to do is to continue that same concept of trying to create a healthier community in Shelby just on our own here, and actually formulating a team of local participants, stakeholders, and some of those same folks who naturally would be on this at this table. And I think it's an exciting thing that can unfold. I think it's an outgrowth of our public health mission. And so it's just a matter of defining the purpose, as you see it there, is defining that purpose and the mission, and then drawing together those coalition partners, and then how often will we meet. I would think we might want to meet at least monthly or every other month at the very, very beginning, and then kind of can start spreading things apart from there. And it may come down to it as well. We'd have to determine what fundings can be put into this initiative from the health levy dollars. You know, if it's being spent through the Shelby City Health Department by an idea that comes out of this coalition rather. Just want to make sure we dot all of our I's and cross all of our T's, make sure we probably want to talk to the auditors and so forth, because again, Richmond Public Health had this grant wherewith they could spend money on swings or blood pressure cups and so forth. And we just had to make sure we were able to do something similar to that when money's collected. So that's it in a nutshell. It's cool though. I think it's a great idea.
Yes, thank you, Finn, for the update. Yes, I think it will also help with the community health assessment and the things we are lacking in terms of public health support from Richmond Public Health when they were helping us here. So, and I think just like you mentioned, we should be able to use some of the health dollars for public education, and that this coalition would be a very good start. I'm very optimistic, and I'm very eager to see how they will work together and work with us. Thank you.
Yes, thank you. Any questions?
Good, thank you.
Right.
Is Lauren here by any chance?
Yes, I'm here, Dr. Chawla. I'm with that.
Hi, Lauren, how are you?
Good, how are you?
Good. I didn't see your name, so thanks for coming and sharing your time with us.
You're welcome.
Mrs. Steve and Monica, do you remember Lauren, right, from last time?
Yes.
Oh, okay, thank you.
So we're going to talk just briefly about the community health assessment, because that is a process we need to move forward with. we might have spoken about this briefly at our first meeting back in February. The state has changed the timeline. Those assessments 5 years, it's moved us to a 2-year timeline. And that, according to the way the rules are written, actually have some part of it done or finished by actually October of 2020. I've been the response focus on that. Most have process, and in fact, the state just released the state health improvement plan a couple of weeks ago. It was late June when that was released, and you need that first because your local improvement plan has to align with some of the state priorities. So they really do work synchronization. So because of that, everybody's behind. So the state told us on a call a couple weeks ago that they were working on allow everyone an extension of time. Great, because everyone needs it. We've talked internally quite a bit about how to go through this process in 2018. Countywide assessment that Richland Public Health.
Lauren, we're having some difficult time. You're getting in and out. You're breaking a lot.
Here it is.
Maybe you can move in a different position in that
Lauren?
room, perhaps.
Hello, Lauren.
A little further away from the noise. And we'll see. Is that any better, Dr. Chawla?
Oh, it's definitely better.
Seems
Thank
to
you.
be.
All right,
Thank
great.
you.
Sorry. Okay. So we worked with Richland Public Health before and participated in the countywide assessment. From what we have found, they're not ready to move forward with their assessment process yet. They're certainly very focused on COVID response, so they don't have a process lined up. We've decided that we would like to move forward, or we think it makes sense to move forward as the city and conduct an independent assessment. We do have a grant that the county or that the city received in early 2019, I think. So we kind of feel we need to use that money as quickly as we can. I don't know what the deadline is off the top of my head. So Dr. Chawla has talked to a couple of vendors about health improvement plan. We actually just this afternoon, a little bit before our meeting started, got a response from the Hospital Council of Northwest Ohio. That's
Yeah. So I can, Lauren, I can just, again, add on what you just mentioned. We have to do a assessment again every 3 years, since like Lauren said. The amount of money in analysis of our city's residents' health is expensive, actually. We have to send about 230 or 240 mailers to city residents. More than that, actually, and we had to get so many response. So to get a meaningful data from city residents, we had to have 237 complete responses. And those responses are based on a health questionnaire. That questionnaire we used that 3 years back, and we can use that questionnaire again with some modifications. But we get the data, somebody has to analyze the data. And just like Lauren said, we have a vendor who we worked with 3 years back. And that vendor has just sent an email about an hour or two back. And they can help us with the analysis and completing our community health assessment. This would be a best way and a cheapest way rather than working with Richland Public Health, because when I talked to them last month, they have a coordinator and public health coordinator. They do not have a committee or a person or a plan in place. And if we delay our plan or our assessment, we will way back again. It will delay everything in our timeline. So we have to be more aggressive in terms of at least doing what we have to do for our city. Even though it will cost a little bit more for us, it will be still better for us to move ahead and get our own assessment done. Last 3 years back, we piggybacked with other stakeholders. There was Ohio Health, Richmond Public Health, there were mental boards, but they pulled all the money together and it was pretty expensive exercise. So if we can use some of the old data and add on or supplement or reanalyze the data, we'll be able to get it done sooner and I would say a little cheaper. But we have to get this assessment done soon as possible before the end of the year, right, Lauren?
Yeah, I think by the end of the year is ideal, because then we have to move to the
And going back to what Mayor has mentioned before, Healthy Shelby Coalition, they are basically more the pillars of the community. In our city, we have to depend on a lot of public health entities, which are not necessarily doing public health, but they are part of the community fabric, whether it's a mental health or Alcoholic Anonymous group or faith-based groups. They all help our city residents, but we can put everybody together under one umbrella. All the thoughts and the process of providing the care to city of Shelby will be much more easier than everybody doing their bit and piece and not putting their efforts together. So what Mayor has been planning is to get everybody together so that we can have everybody have their say in helping our city. And we use the data to reach out to disadvantaged groups or people or I would say those population which is at risk, such as sexually transmitted diseases, obesity, tobacco users, alcohol and drug abusers. So we can reach out and help them in a better way than we have done so far.
Yeah, I think the list of partners that Dr. Tell mentioned, that's really key. And the Mayor was talking about the Healthy Shelby Coalition. I think these two projects really, in my mind at least, kind of connect and are a good opportunity for us to brainstorm who in our community we would like to ask to be involved. Well, from that perspective. So I think send out the in this meeting, we'll send you guys link to the state health assessment and the state health improvement plan that have just recently been released, so you can see. And you have a few minutes to go into the document, kind of get a feel of what for our the current chip and chop for the county are on the Shelby City Health Department website, so you can get those. Tell us that we just got the out, so we can talk about that, but it looks.
Sure. Hey, Lauren, you might have to move your mic again. I'm sorry.
Internet problem here.
Yeah, it's internet problem. So,
That's all I have.
is it possible if you want to just do the audio, or I don't know, but it's a little spotty, the internet and the connection to your website or to our system.
Yeah, I don't. We got rid of the background noise. It seems like it's the internet connection.
It's better now. It's better now.
Okay. Let me quickly then give you the accreditation update. That will be brief. Had dialogue with FAB, the Public Health Accrediting Board, in the last couple of weeks. We had been on the hold from March to about early June. Kind of position possible because we are go and wait for a site visit team, and that they're trying to catch up on site visits of the people that were scheduled and had to be canceled through COVID, and that's their priority right now. And once they get that done, they will try to get a site visit.
Hey, Lauren, would you mind if I can, since there's a connection issue, I want to make sure everybody hears. Is it okay if I speak for you, Lauren, if you don't mind, please?
Go right ahead.
Okay, good. You can hear me, Steve and Monica, okay?
Mm-hmm.
Okay, I'm sorry again. Lauren has been a wonderful resource for us, and thanks for working with us so far. Thank you. Just to give an update, we talked about last meeting we had in about last advisory board meeting. We are in process of accreditation. And last year, when we submitted our documents in October, we were waiting for a site assessment. And unfortunately, there was a 3 to 4 months gap of anyway, because they were so behind. The FAB is the Public Health Accreditation Board. They are based in Maryland, actually, and near Washington, DC. They were supposed to audit us or go over our process and do accreditation process. But they were late anyway. when the COVID virus came in March, they are further behind. Now they're talking about doing a televisits, like doing a Zoom meetings, going over the process, not actually visiting us in person, but doing a remote accreditation or assessment. We have not, we did let them know that they can choose any, they send a list of people whom they can choose from, or if we have objection to the name. For example, if somebody worked with us and do we want to exclude their name from a potential site investigator or not? So they send a list of people and we have no objection to anybody can come from any state department across the country, visit us, or analyze our documents and approve or suggest what they have to do. So we have no problem anybody coming to analyze our accreditation process and moving forward. So the problem is that it's almost a year in October that we have submitted our documents and we have no confirmed site visit as of now, which means we don't even know if the board will be able to send us or will be able to assign any team of site investigators who will come and or who will judge our accreditation process. So things are on the back burner and we have no commitment from the FAB. Me and Lauren and everybody are in contact with the FAB. And once we get some updates, we'll let you know. But so far, I do not have any update on when this accreditation process will be judged or scrutinized by the FAB. But I hope it happens soon before the end of the year. Lauren, anything else I missed? Lauren, okay, Beth and Tiffany, do you have anything to add on in terms of accreditation?
No, nothing for me.
Okay.
Nothing here.
Okay. So we'll keep you updated. And once again, I will make sure that the minutes of the meeting every month are sent to you as well, to all the advisory boards. So you will know how our health department is approaching the accreditation, but that's very important for us. And with all the efforts we have put in as a health department, if we don't get the accreditation on time, it will be really frustrating for us to spend all the money and efforts and also we have to pay a annual maintenance of accreditation fee. It's a fee we have to pay every year. And if we delay already, it means we are already paid the money, not get the accreditation is like we are paying for something we don't have in hand. It's like you're paying for a degree, but don't get a degree in hand. So it's a little bit financially and as well as psychologically frustrating for all of us here. Anyway, so we'll let you know if something happens, but so far we do not have any plan of having a site visit by anybody from FAB. And Beth, you want to go over the marketing plans?
We put back in 2019, we have a communication plan, and I can always send that to anybody that wants it. What it does is it tells, what our health department's doing, what our communication process is. Let residents and the people of Shelby know everything we're doing. So we have a communication try to follow the national, there's like February, there's American Heart Month, put information on about those type of things. May, Arthritis Awareness Month. August is Children's Eye Health. There's just a whole list. So we try to, when we have time to put on our Facebook, Twitter, to remind people, doctor's appointments, any type of health issues. And then we also have been putting on, like daily, if we have time, updates, like on the COVID-19, we've been every time we get new cases, we, on our Facebook, Twitter feeds, we put, new information about the marriage out, an email, blog, Globe put something, in for people on their Facebook and in the paper. And, so like a mosquito spraying, same thing. We put out, usually whenever we're gonna spray, we have to put a couple, dates notice out in case anybody wants no spray in their area. That stuff, public notices, anything, have, because we, Twitter, have what's called Nexel, where you can sign up, for that. Have to send them, like, who would have been having a vaccine.
Hey, Beth, we have difficult time. You're breaking a lot.
Sorry, it's our internet. So we have
Okay.
Nixle. Can you hear now?
A little better, thank you.
Okay, we have Nixle, which is through the police department. So when a vaccination clinic is coming up in the area, we would have them Nixle alert out, so people that signed up, they would get those. But, we do have a communication plan to try to make sure we keep the general public and residents in Shelby City updated on things we're doing. So that's that on the parking. On the spring cleanup, we put that with the July utility bill flyer, mayor there, that on the bright screen, trying to if we would have done it at normal time, we would have sent them home with all the school kids. Because the problem with utilities, sometimes it goes to the owner and maybe not the residents that need it there get it. So we're working, trying to come up with a plan to either do door knockers or something. Just with the COVID-19 this year, that knocked us off our plan on some of our ideas. We had to get it to the time 8 to 4:30
Hey,
Saturday.
Hey, Beth,
Beth,
maybe I'll pick it up from here.
Yes, thank you.
Because again, it's just kind of really breaking up like crazy, but it will be July 16th through the 18th. The collection site, of course, is down from kind of catty corner from the new fire station. So Thursday and Friday from 8 to 2. I'm sorry, 8 to 5 rather than, hang on a second. We'll be on from 8 to 5 Thursday and Friday, and then from 8 to 2 on Saturday. There we go. All right. You'd think I'd know it by now, wouldn't you? We are not taking limbs, branches, or trimmings of that nature this year. We're not able to get rid of those the way we used to in the past. So that did post the Richland County compost facility on Carnes Road for folks who could take things over there, and we have the hours listed. And so all the other items are listed. What we're trying to help folks get out of their backyards and side yards and so forth, exterior, primarily exterior items. And so it shows what we will and will not accept. And then to request assistance for the elderly or disabled, we have the phone number to call. So I think it's gone well over the last few years. It's just going to be a little bit of a different year for us. But I thank Beth publicly at our safety committee meeting. She does a great job of lining up all the dumpsters and everything that's involved with this and with our service department. And so it's a great opportunity for our city to get things cleaned up. And then it allows us, if someone does not, and when we have to write them up or take stronger action, we say, we gave you the opportunity right here in the city. Just if you could have gotten rid of this. So it's great, proactive. We're trying to light a candle rather than just curse the darkness.
Thank you, Mayor, for the update. I know it's we planned for an hour-long meeting, so we're a little bit few minutes after that. But we try to basically spending more efforts on our COVID outbreak. protecting our community against the infection and promoting, the message that social distancing and mask wearing as much as possible. The major piece of our work is lies with the getting a healthy coalition and community health assessment this year, and that's very important for us. It
Yep.
puts basically a roadmap for next 3 years to come, and we can put some resources and money and funding or apply for the grants if we can identify or see what kind of population diseases or disease affecting a population in our area. So it's very important that we should have a good assessment done as soon as possible.
Yes.
And Lauren is still working with us to continue her efforts to with the accreditation, and she's a good resource for us. So certainly we had some technical issues today, but hopefully next time we'll meet in next 3-4 months, November maybe, we should be able to meet in person in a larger room, in a bigger room with adequate gap. So we should be able to have a rather face-to-face meeting next time.
Mhm.
And we do that in our city. We do wear masks, like, our weekly, our monthly health board meeting in our city. So we'll try to keep you guys come in person next time.
Sounds good.
Thanks, Monica, for your time today. Is something we missed, or you have a concern, or you heard from everybody? You are
No,
very active in
would like-
community.
I would like to commend the staff. They do an excellent job between social media, the Globe, and inserts with the utility bills. You're really getting the word out. I think kudos to the team. I know how much time it takes. So,
Thank you, Monica. I know that you are a very popular person in community. So certainly, how the people feel about health department.
Yeah.
So thanks for your.
And
And
I
Mrs.
agree that you do a great job and just keep up the good work and just deal with this virus the best you can.
Thank you, Steve. And now it's good to have you on board as advisory board, since you know how the ins and outs. So it gives you a little bit more edge, so to understand our health department, how it works. So I appreciate your time and commitment today.
Yes.
And thank you for being on board with us.
Thank you
good to
both.
see
Yeah.
everybody again.
Yeah, it
Yes.
is.
So hopefully next time it would be in the same room we had a meeting next time. Thank you.
Sure.
Thank you,
Sounds
everyone.
good.
Thank you,
Take
Mayor.
care.
Thanks for
Bye.
coming here.
Bye-bye.
Thank you,
Bye-bye.
Beth, Lauren, and Tiffany.
Don't forget, we have a Board of Health meeting next.
Yes, I know.
Have fun.
Okay, thank you.
I could be there for 10 minutes.
Yes. Okay, bye-bye.
Bye.